Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, and Genuine Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our guests are Melissa Overly, pharmacist, manager of the manager of the Medicine Center Pharmacy in Minerva, Ohio, and Michelle McCann, physical therapist with Altman Therapy Services. It's a family show today as Michelle and Melissa are sisters, working together to share important information about fall risks today. Good morning, Melissa and Michelle. Welcome to the show.
Hi, Paul. Good morning. Good morning. Thank you.
Fall prevention may not seem like a lively topic, but it's important. Each year, millions of adults age 65 and older fall. Falls can cause moderate to severe injuries, but the most important message is that falls can be prevented. Falls are often considered to be part of a syndrome. In other words, more than one thing may be causing the condition. As a result, there is often a benefit from a team approach where various disciplines can contribute to the assessment and treatment of the condition. Today, our discussion includes both a physical therapist and a pharmacist to get their perspectives on fall prevention. We'd like to remind our listeners today, our program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Melissa, welcome to the show. Tell us a little bit about yourself and your background.
Hi, I'm Melissa Overly. I'm the pharmacy manager at the Medicine Center Pharmacy in Minerva. I have worked there for a little bit over 12 years now. I graduated from the Ohio State University College of Pharmacy in 1999, which definitely ages me, but I have worked retail pharmacy my entire career. I enjoy working with people and being able to talk to my patients on a daily basis and have an impact in their daily lives. So I don't want to be anywhere else. I do really enjoy being there at the Medicine Center, and I do enjoy retail pharmacy.
And Michelle, welcome back to the show because you've been on before, as I recall. Tell us a little bit about yourself, your background, and your responsibilities at Altman.
Well, thank you, Paul and Brad. It's great to be back again. And Melissa, thank you for educating alongside me today. Because this is a family affair, I'll just say quickly, hi, Mom, and hi, Dad. Thank you for tuning in. Okay. That's Bob and Sue Miller, so we have to say hello. I'm a physical therapist in the outpatient setting at Altman Tusk. Altman Tusk is located across from the main hospital, and we're neighbors with your Canton Medicine Center store. My areas of specialty within physical therapy are in the treatment of chronic pain, lower back pain, and in orthopedics.
So, Michelle, when we discuss fall prevention therapy, who should we be considering?
Well, I say everyone. We all live in a world with gravity, and falls are truly accidents. For Health Matters today, we'll focus on higher risk groups. The bottom line is many falls can be prevented. So who is fall prevention therapy for? The higher risk group includes many of our listeners. You're at risk if you're 65 and older. You're at risk if you're on more than 4 medications, and Melissa will talk more about that soon. You're at a great risk if you've had a history of falls. So the statistic is falling once doubles your chance of falling again. A few more, you're at risk if you use a walker or a cane, if you have a balance disorder, if you have muscle weakness or arthritis. You're also at risk if you have any vision problems, any neurological deficits, for example, a stroke or a spinal cord injury, if you have depression, cognitive impairment, or if you've had even a cardiovascular deficit. So who is at risk? I imagine our listeners today can identify with one or more of those categories listed.
So how costly and serious and how costly can a fall be?
Well, it's very surprising when I read this information, but I found out that actually 1 out of 5 falls causes a serious injury, such as a broken bone or a head injury. And 1 out of 5 is just a scary number. And falls are the most common cause of traumatic brain injuries and hip fractures. In 2015 alone, the total medical cost for falls exceeded $50 billion. And of that $50 billion, 75% of that cost had to be shouldered by Medicare and Medicaid alone. But besides the cost, what really, I think the biggest cost truly is the cost to how it affects people's lives. From what I see with my patients on a daily basis, the falls are the most common reason why people lose their independence. And unfortunately, sometimes to never regain that independence again. So if that fall could be prevented, it could really improve a person's long-term quality of life. That's the biggest cost I see.
So what does fall prevention involve, and what are the goals for a multidisciplinary approach to treating falls?
Fall prevention, as far as a multidisciplinary approach, actually involves four main groups of people, as we can see it, working together, all from different angles of expertise. Those four groups of people would include the physical therapist, the pharmacist, the doctor, family doctor, the eye doctor, and I guess the fifth would be the individual themselves.
And from this collaboration team, these treatments can include just working on building your strength and endurance with an exercise program, which starts in physical therapy, but continues after the completion of physical therapy. Balance and enduring training, again, that is learned in therapy, but that you have a lifetime plan to maintain. Implementing lifestyle changes that address ongoing risk factors. We're going to be talking more about the medication review, regular vision testing, your physical activity. And lastly, just working on making sure we provide our patients or our listeners with information on creating a safe environment.
What does a physical therapy evaluation for falls look like?
Well, if the patient is referred to therapy for an evaluation, either following a fall specifically for fall prevention, they would see a physical therapist for initial evaluation. That visit takes about an hour long, and it's highly individualized. So if you came to see me for physical therapy, I first want to hear your story. I want to hear how you felt, what happened, what led up to it, what got injured, how are you doing, and what happened, later that day, whether you went to the emergency room or what medical care you received initially. I want to know about your pain and your overall healing. Then I would go through the assessment part of checking your strength and looking at your walking, watching your walk to make notes of any imbalances that we can work on with therapy. I would also have you undergo some balance testing. Balance testing is special testing that is intended to produce a score that I can do your first day and maybe several weeks later at the end of your therapy to look for your amount of improvement in your balance, and also to provide information back to a physician of your baseline scores. I would also check your vitals. A lot can be learned, for example, with just checking your blood pressure in sitting, standing, or lying. Some good basic advice is to stand up slowly to avoid dizziness, and that you should pause in initial standing before you take off and walk too quickly. A few more things we check at your physical therapy evaluation would be your endurance and your aerobic cardiac tolerance. We'd also have conversations about your nutrition and wellness. Just are you staying hydrated? Are you making choices about your own health and wellness? If you're having specifically dizziness, we'd have you see one of our vestibular therapy specialists. This is a specialty of PT that's aimed at getting to the root cause of dizziness, and we offer that here at our Altman-Tusk location. And finally, we come up with a plan together, working with the patient to determine what exercises are most appropriate and what your long-term plan is after physical therapy.
Okay, Melissa, can you explain to our listeners what a comprehensive medication review is by a pharmacist?
Sure, absolutely. A comprehensive medication review, also known as a CMR, is a chance where a patient gets scheduled one-on-one sit-down time with a pharmacist to review their medications. This is also called a brown bag review.
because we like to ask the patient to bring in all their medication bottles in a bag, everything they take, whether it's prescription or over the counter, whether it's from the medicine center pharmacy or their mail order or another pharmacy, just so we can get a look at everything that they take and just try to make sure that there's no duplications between things that are filled at different pharmacies or interactions. Lots of times, unfortunately, even with the prescribers, they don't always have a good list of everything a patient takes because they go to multiple doctors for multiple different specialties. And so it's a good chance to just look at the big picture and find out if the big picture makes sense. Also look at patients' technique with certain medications like inhalers. Are they using them properly to get the best effect out of them? Do they do they understand as far as if they're on insulin, how to properly use the insulin pens and how to interpret what their blood sugar means. And it's just a time I really enjoy a lot, because normally in a day-to-day time, we're so busy, we don't get to talk to our patients that much and get to see the big picture. And it's enjoyable to get to see the big picture and get to know our patients better. It's especially helpful for patients who see multiple doctors or go to multiple pharmacies or take multiple medications.
Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, don't forget to stop in for your flu shot or a COVID booster. Walk-ins are welcome or appointments can be made on our website, medshoprx.com. We look forward to helping you stay healthy.
Okay, how can a comprehensive medication review by a pharmacist help prevent falls?
Yes, absolutely. This can be beneficial at looking at the fall risk and preventing falls. Pharmacists, when sitting down with the patients, can look for medications that the patient may be taking that can increase their risk of falls, or in combination with other medications when put together that can increase the risk of falls. The pharmacist can look for medication that's what's known as the Beers list, which is a high risk list of medication for older adults. And then after looking at the list to determine which medications may be high risk for the patient and may potentially contribute to them having a higher chance of having a fall, it can be determined if possibly if any of those medications can be reduced to a lower dosage, possibly changed to another medication that may be just as effective but of lower risk, or possibly if the medication can over time even be eliminated if it's not absolutely necessary.
I know we have a fancy term for this. Can you explain what de-prescribing is?
De-prescribing, yes. And it's, it's a kind of an opposite term of what people normally think of when they go to the doctor. They think that, oh, I'm going to the doctor, he's going to put me on more medication. Well, sometimes more isn't always better. Sometimes we find that the patients end up, as they get older, maybe being on medications that when they were younger, they were safe, but as they age and their, body's metabolism changes and their abilities change, that possibly those medications that were safe when they were younger tend to not be as safe as they age. And the pharmacist can work together with the patient's physician to look at the medications which possibly may be at high risk for the patient or unnecessary for them to be taking anymore as they age. When the pharmacist and the patient and the doctor work together to look at this, it's possible that some medication doses may be able to be reduced, or medications could be changed to a safer option, or even a non-drug therapy may be tried, or a lifestyle change. And I do have one word of caution with this, though. I don't want anybody to try to stop taking any of their medications or reduce them without their physician's advice and their physician's help. It's up to the physician working with the patient and the pharmacist together to determine what medications may be able to be reduced. Some medications are not safe to be stopped suddenly, and some medications are not safe to be stopped at all. That being said, though, that there are often safer alternatives for patients, but always done under the doctor's advice.
Interesting.
Can you touch on a couple of the main categories of medications that can directly impact falls and maybe a couple of examples that might resonate with listeners today?
Sure, absolutely. And like I mentioned before, if you take one of these medications, just, don't jump to any conclusions and just stop the medication suddenly, because that's not what we're trying to hint at all here. But the main three categories, the way I like to think of it at least, are number one, medications that affect the brain. Category number two, medications that affect the blood pressure. And category number three, medications that affect the blood sugar. The first category, medications that affect the brain, is really an extremely broad category, but it can include medications for anxiety. Lots of times things like lorazepam or Ativan. It can also include medications that are used to help people sleep, possibly like zolpidem or other medications for insomnia. It can include certain medications for mental health, or certain what are known as antipsychotic medications. Can also include certain pain medications. Opioids would be in this category. So would certain antidepressants, and even some allergy medications, potentially like Benadryl, could be considered in this category that can affect the brain. So it's a very broad category of a lot of very useful, but also some very high risk medications as well. Medications that affect the blood pressure. Michelle had mentioned this earlier, as far as the term is called orthostatic hypertension, where your blood pressure can drop suddenly when you go from laying down to sitting up or standing. And there are medications that contribute to that problem. Some blood pressure medications do. An example would be clonidine. And then also some examples would be some medications actually that you might not even think of that have that effect as well, that are for urination, like tamsulosin, which is also known as Flomax, or doxazosin. And so when these medications or medications similar to these can cause a sudden drop in the blood pressure, if that happens when someone's standing, that could cause them to get dizzy and have a greater chance of falling, especially if they get up quickly, especially during the night. And then the last category that I mentioned, and this deals mostly with patients that are diabetic or on medications for diabetes, but medications that lower the blood sugar. Because if the blood sugar drops suddenly or stays low for too long, that can contribute to a patient's risk of falling. Two examples of ones that we think of a lot are glimepiride and glyburide, because they can cause, in some older adults, prolonged blood sugar that is too low. So an example like this, a better choice would be something like glipizide. So that is one of the things that can be done, is just switching from one diabetic medication to another to try to reduce the risk of the blood sugar going too low for too long. Insulin, of course, can be a problem as well. Insulin is definitely a life-saving medication, but if it's used in a patient that's not really understanding how to take their insulin, or not, checking their blood sugar properly or staying on top of it, unfortunately, insulin can cause the blood sugar to go too low. There are some new meters out, like the Dexcom, which are really good as far as even continuously monitoring the blood sugar and sending alerts to the patients they know their blood sugar is too low. So something like that, if you're diabetic and you have risk of your blood sugar going too low, something like that is a very good idea.
All right. Well, you just mentioned quite a few medications that we see patients taking frequently. If someone's concerned about one of the medications you just mentioned and are concerned about a fall risk, what message do you have for them to talk with their doctor about?
Okay. Yes, absolutely. As I said before, do talk to your doctor, and don't just try to take yourself off one of these medications on your own, because it could absolutely not be safe. But what the CDC is telling healthcare providers is pretty simple. It's just a 3-word acronym. It goes stop, switch, reduce. So stop is for stop the medication when possible. Switch is switch to a safer alternative. Or reduce the dose to the lowest effective dose possible. So it's not, it's not, with all medications, it's not possible to stop them, but it is possible to at least go to the lowest effective dose, or maybe potentially switch to something that is similar but
much safer as far as not being nearly as risky for an older adult with their risk of falling and everything. But it's very important that the patient is on board with this and actively participates in the decisions that are being made if it's involving changing any of their medications. The thing that we see that's really hard is some patients we see most often say, well, I've been taking that, particular anti-anxiety or sleep pill for 30 years and I've never had a problem.
Yeah.
And true, you haven't had a problem yet. But sadly, as we age, some of these medications that were so, helpful when we were younger, but as we age and, our body is changing, sometimes they become a problem, even though they weren't a problem before. But it's so in that respect, sometimes it's hard to see that, but it really is true.
So for every potentially risky medication, what are some questions that maybe a patient should ask their family doctor or pharmacist?
Well, this may sound simple, but the first question is, what is this medication for and why am I taking it? When we review medications with patients, lots of times they say, well, gosh, I've been on that medicine for 10 years and I'm not really even sure why I take it anymore. So why am I on it? And okay, if I'm on it, is it still necessary for me to take it? Or possibly, is there another option that would be safer for me to take? And then, of course, what are the risks and benefits of either continuing the medication or stopping the medication? With medication, it's not as nearly as black and white as we would like to think it is. Everything pretty much has to be weighed on a risk versus benefit ratio. And there's, of course, always a risk to stopping a medication and there's a risk to continuing a medication. You kind of have to look at which is bigger for a particular patient in their situation. And of course, the question of, okay, if I can't stop this medication, maybe can I take a lower dose for a while and see how I do with a lower dosage?
What should our listeners do to consider if they want to make their homes safer? Now, I know we got rugs everywhere in our houses and things to trip over and dogs and cats to trip over. What do we do?
Well, many falls happen at home where we spend much of our time and tend to move around without thinking about safety. But you were absolutely right. The first thing you said is rugs. Remove those loose throw rugs and reduce clutter. If we've lived in our home a long time, we tend to accumulate lots of stuff. We can also look at our seating. It's best to have chairs that are not too low and that have arms and have no wheels. So our rolling kitchen chairs or computer chairs would best to be a standard chair. We need to look at lighting, especially in bedrooms and in stairways. One thing you can do to make yourself safer in your home is to wear proper shoes. The safest shoes have laces or Velcro and are more traditionally like a tennis shoe or athletic shoe. The highest risk of falls comes from walking around in bare feet or stocking feet. You can also ensure that you've got handrails on both sides of the stairs and that if you're not able to safely complete your stairs, that you can consider a stair lift. It's best to not stand on tables and chairs. There's a lot of tools that we can show you in therapy, like using a reacher stick to get something off of a higher area. And grab bars are fantastic. You can place a grab bar in a home anywhere you naturally touch the wall. For example, going from one step down to the next step where your hand automatically contacts.
I was in a house over the weekend real quickly here that had all this real thick carpet on the steps going down the basement, and a straight shot and then a right turn and then a left turn on the stairway. And the carpet must have felt like it was about 4 inches thick. And I just thought, my gosh, how could these people have done this and not fallen down these steps? Okay, it's time for a break. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Michelle McCann, physical therapist with Altman Therapy Services, and Melissa Overly, pharmacist at the Medicine Center Pharmacy in Minerva. We have a lot more to cover this morning, so let's get back to the show. Where are we? Okay. How can we be best prepared in the event of a fall?
That's a good question, Paul. Hopefully that fall never happens, but if it does, obviously we want to be prepared. And this is especially important for anyone who lives alone, especially if they're older and if they fall, they may not be able to get back up on their own. And one thing that is very helpful is something called a medical alert device. And a medical alert device is something that can be worn as like a bracelet or a necklace that can help alert the 911 or medical personnel if you've fallen, and make it so that you're not just laying there where you can't reach help. If another option besides medical alert device would possibly even keeping a cell phone on you at bare minimum so that you could try to call somebody if you fell. But it's very, very important to have some way if you fall to contact somebody. I saw this actually very scarily firsthand a few months ago when my husband and I were on vacation down in Tennessee. We went on a run, and when we were coming back from our run, it was dusk and it was starting to get dark and we couldn't see very much. And we heard a gentleman yelling, and to our surprise, we looked over on the side of the ditch coming up the hill, and there was an older gentleman laying in the ditch. And he had been down to the lake to fish, and he had fallen while trying to start his four-wheeler and hurt his back and hadn't been able to get back up. And he had been crawling up the hill for the last 2 hours. And it was just a freak that we even heard him and saw him, and my husband was able to get him back up and get him home and get him to some medical attention. But it made me realize how important it is to have some kind of medical alert device or cell phone or something on your person if you fall and can't get help. Because where we were located, if we had not seen him, he likely would have laid there all night, and I'm not sure what would have happened. So it is really scary, and it really is important to have a way to get help if you fall.
This is an interesting thing I've heard people say, Michelle. Many people do not like to use a cane or a walker because they believe it is a sign of weakness. And I've heard a husband say to a wife or a wife say to a husband, oh, well, come on, use your cane. I don't want to use my cane. That looks silly, or I look like I'm weak or whatever. So how do you address the stigma that accompanies the use of administrative devices?
We walk alongside someone in physical therapy and really hear their concerns, because whether it's weakness or whether it's pride, if you can really show someone that they're able to walk safer, walk better, that their balance is scoring better with the device, and just get used to it, get comfortable with it, have it become natural, and show that it really is the safest choice, that they're in charge of reducing and eliminating preventable falls for their own health. And if it's something that is needed, that we just reinforce that positively. However, in therapy, if someone is appropriate to gain strength, gain balance, a lot of times we're able to progress someone away from the walker or cane safely, but with the guidance of our therapy team.
So can you share some home improvement resources, Michelle?
Yeah, that's a great question, because there's so much support out there. My first thought is make sure you're talking to your family or your support system. For example, if your family is telling you, hey, you can't get up on the roof anymore, it's not safe.
Yeah, right.
That's a big safety risk. You should talk with your family about, well, the reason I'm getting up there is for the leaves or for the clean the gutters or for the Christmas lights, that you're not saying to a family member, you can't do this or you can't do that, without collaborating a solution to how that task is going to get done. Because if that task no longer needs done, then you're taking away a big risk of not having a loved one climb up on a roof. But there's great resources. Altman has a home safety visit program where Primetime and Alt Care cover a visit of a therapist coming out to the home and looking everything over structurally, making recommendations. Truly, how can you make the environment of the individual a safer place? I'd like to give their number. Their phone number is 330-771-0112. Again, that's for the Altman Home Safety Visit. There's other resources. You can have actual Altman Home Care come into the home where you have a team of physical therapy, occupational therapy, nursing, an aide, a support team to focus on addressing, the person in that environment. That solution is for patients that are homebound, that it's a taxing effort to leave the home. There's other resources, tapping into the area agency on aging, or even with our local health department.
Any other suggestions, Michelle?
Just making sure that you're talking with your family, talking with your physician, scheduling your appointment for your eye doctor, and that you're considering the benefits and the appropriateness of coming to see us in physical therapy.
All right, Michelle, what can happen after a fall?
Well, many falls do not cause an injury. 1 out of 5 falls, Melissa said earlier, do cause such a serious injury like a broken bone or a head injury. These injuries make it hard for a person to get around or go about their daily activities. But despite that seriousness, our tissues heal, our bones heal, our physical injuries can be rehabilitated with hard work and with physical therapy. However, many people who fall, even if they're not injured, become afraid of falling. This fear may cause a person to cut down on their everyday activities and do less. They may find themselves sitting more. When a person is less active, then they become weaker, and then that weakness also increases their chances of falling. I mean, as humans, we derive both pleasure and peace from maintaining our social life. This is true at any age and includes older adults. This social interaction that keeps us going on a daily basis is so valuable, and a fall can jeopardize our only socialization space. So a fall not only poses a threat to physical health, but it also can impact our mental health. It's essential to consider fall prevention and be proactive.
Earlier, you mentioned a physical therapy evaluation for falls. So if someone has a fall, is that the opportunity to talk with the physician and schedule that evaluation?
Yep, please come and see physical therapy either before or after a fall. Remember the statistic that if you've had a fall, you're 50% more likely to have another. And listen to your gut. If you're being honest with yourself and you have some fears about falling, please come see a physical therapist, talk to your physician, talk to your pharmacist, and be proactive about your own health.
So Michelle, how do you schedule time to see a therapist?
The best place to start is by talking with your family doctor. They should be knowledgeable of how you're doing and your concerns. Your family doctor may then refer you to physical therapy. Altman has several options for physical therapy in Canton, Stark County, and the surrounding areas. I'm at the Altman Tusk location, but we have locations in North Canton, Massillon, Louisville, Carrollton, Navarre, and a new location in Altman, Dover.
Okay. Our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us this morning. Let's get back to the last segment of the show.
Okay, Melissa, how can our listeners or patients reach out to you and schedule a time for a comprehensive medication review consultation?
Sure, absolutely. I can be reached at the Medicine Center Pharmacy in Minerva. Our phone number is 330-868-6200. That's 330-868-6200. We are open Monday through Friday, 9:30 to 6, and on Saturday, 9:30 to 2. I'd be more than happy to schedule a time that I can sit down with a patient to review their medications.
Okay, and Michelle, how can our listeners reach out to you to learn more or to schedule an appointment with a physical therapist?
Sure, I would love to hear from our listeners. The direct phone number at our Altman Tusk location is 330-363-6215. Again, that's 330-363-6215. We can also facilitate having you schedule at one of our other outpatient locations. For our listeners that it would be a taxing effort to come to an outpatient facility, you can consider calling Altman Healthcare in your home, located out of Altman Woodlawn, where if someone is appropriate because they are medically homebound, not able to come out, that a therapy team and nursing as well could come to your home. I'd like to give out that number one more time for Altman Home Safety Program, and that's 330-771-0112. And I'd like to add one more thought about our clinic here at Altman Tusk, because we have so many specialty services we offer that also relate to fall and fall prevention. We have our vestibular therapy team here, where a patient can be seen to get to that root cause of their dizziness. We also have the specialty of concussion and rehabilitation of concussion injuries. If you have a head injury after a fall, you can see our concussion expert here. Here at Tusk, we also do orthopedics, sports rehabilitation, general strength and conditioning. We also offer occupational therapy, speech therapy, and outpatient lymphedema services.
Can you explain what the various type of brain injuries or head injuries from a fall? Concussion, maybe in particular. I mean, that's all we hear about is that they're going to check you for a concussion if you fell or something.
Well, yes, a concussion or a traumatic brain injury, but a concussion really is a brain injury that affects how your brain works. It's caused by a blow or head to the head or body. So essentially, if your head was struck as you fell down, in sports, when you're thinking of athletes, it's from, contact with another player or hitting a hard surface like the ice or the court, or being hit by another person. But a concussion can happen even if you haven't been knocked unconscious. That's important to know. And if you think you have a concussion, you should, if you're an athlete, you're not to return to play. That's very important, but you need to be cleared by a healthcare professional to be okay to return to play. Some symptoms of concussion can be headache, confusion, difficulty remembering or paying attention. It can be balance problems as well, or feeling sluggish or groggy. If you have a concussion, you can feel more emotional or down. You can have nausea, vomiting, sensitivity to light, or slowed reaction time. So if you've had a fall with a head injury and are having some of these symptoms, you need to let your physician know and come see our concussion expert, Morgan, here at the Altman Tusk location.
Does a concussion mean bleeding inside the skull or just a bruise to the skull?
A concussion is an injury to the brain, but I think that when you're talking about a bleed, you're talking about something more complex and serious. But I would prefer to defer more questions about concussion to our concussion expert, because that is a different area than I myself specialize in.
Sorry.
So, no, Paul, I think you should come see Morgan. You have great questions.
Okay, sorry. Okay.
All right, Michelle, are there any important messages you want to leave our listeners with today?
I'd like you to come see us in therapy and talk these concerns through, and how you can best keep yourself safe at home. Physical therapy can look different. It used to be coming to therapy 3 times a week for 4 or 6 weeks. And that may be the case if that's what's needed. Sometimes you can come to therapy and do just a few visits to learn a home program that you can do on your own to best maintain your strength, flexibility, and balance. So reach out to your family doctor, follow up with your pharmacist, your physician, and come see us in the physical therapy world. We've got really hardworking, good people here in therapy that are experts in this profession and that really care.
Wow.
All right, Melissa, what's the most important message you'd like to leave listeners with today?
Oh, yes, probably a couple things. First of all, just the idea that preventing falls and the resulting injuries is one of the best ways that older adults can continue to live independently and continue to be able to leave their home on their own and stay healthy. And reducing or eliminating high-risk medications is one of the areas that can, although it's not simple, it's still one of the easier areas that can be changed to help prevent this risk of falls. And if I know, just is one of the things that is most important to a lot of people is continuing to live independently as long as possible and to have the best quality of life as long as possible. And by preventing a fall, that often is how that can be done. And one thing I think of lots of times, as well as relates to what Michelle was said, was about, mom, dad, is it really a good idea to still go up on the roof? Or, not referring to our dad in particular, but, sometimes just because you can do something doesn't necessarily mean it's a good idea. Even with just me, I'm in my 40s, and sometimes if there's something really heavy to lift at work, I'll ask Zach, my technician, I'll say, hey, Zach, can you lift that for me? Because yeah, could I maybe lift that myself? But is it necessary? He's probably less likely to hurt his back than I would be. So sometimes just it's okay to ask for help instead of doing something that might be risky that you may regret later if you fall or get some other serious injury.
That's a great point, Missy. I think what you're asking is what I'm able to do versus what is safe to do. And I'm not sure you're going to get dad off the roof or trees, right?
Right, but
I hope you're listening, Dad.
Okay.
Oh.
I got a lot of leaves on my roof that need to be cleaned off right now, so I shouldn't get on the roof, eh?
No,
No,
let's
no.
make a better plan for that.
Okay. How about a blower to blow them all out?
That's fantastic.
That may work, Paul.
Okay. I think we're still giving flu shots and corona shots too at our stores.
Yes,
so
absolutely.
across the company, all of our stores. So
Yep, we've got the regular flu shot, the high dose flu shot for age 65 and up. And we also have been giving a lot of the new Moderna boosters that cover not only the original strains of the virus, but also the newer Omicron strains. And you definitely can stop in anytime for a vaccine. We do walk-in appointments or just walk-ins, and we do schedule appointments online, but feel free to walk in without an appointment. That's absolutely fine.
Okay. Thank you to our guest, Melissa Overly, RPH, manager of the Medicine Center Pharmacy in Minerva, Ohio, and Michelle McCann, physical therapist with Altman Therapy Services. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health Systems, Studio Arts and Glass, and Genier Appraisals and Liquidations. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. Thank you very much, ladies.
Thank you.
Thank you.
We enjoyed it. Take care. Have a good day.
You too.
All right,
You
before you hang up, everybody look at your camera and smile so we can get a good picture for the tile, okay?
Gosh.